I can't cure the common cold. I can't cure this. But I maybe help somebody avoid this.
That's Sue Stewart on why she took part in a recent IU School of Medicine COVID-19 study on children and adults in Marion County. Now, the research focused on those who do not display any symptoms of the disease. Most COVID-19 studies only key in on adults, but the outcomes revealed why it's just as important to include asymptomatic children. The results are in now, and they help answer some big questions that parents and school leaders have been really wrestling with as students head back to class. Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. The results now show that asymptomatic COVID-19 infection is possible in children under 10, but it is a very low number. And these asymptomatic kids may not be as contagious as previously thought. The insights shed light on issues surrounding school. Here to help us sort through those is Dr. James Wood, the study's co-leader and an infectious disease doctor at Riley Hospital for Children. Dr. Wood, thank you for being on the show today.
Appreciate you having me.
So this study, it's the first of its kind in the U.S. What makes it so unique, even on a national scale?
Yeah, so we were able to go into the community and test families, including young children, as you mentioned, which was really important to us. We really wanted to focus on kids under 10 and kids of all ages because that's just an area where this disease hasn't been studied enough, in our opinion. To go out into the community. So we were able to test people that weren't having to come to the hospital or weren't able to go to a study site, for example. So it gave us a little bit better idea of what was actually going on in the community.
Okay, so the study sampled 511 people in Marion County. One of those tested positive for COVID-19, and interestingly, it was a 7-year-old. So tell us about that one case, and what are we learning from that one case in that child?
Right. So we did show that that a 7-year-old child was positive, and so that was really kind of the first of its kind that we were able to know that young children can have the virus asymptomatically. That's something we thought and probably figured was the case, but to be able to show it in a scientific study, is really important. And I think as there's so much information that goes out, really showing that in a well-designed study is super important. And so we were able to do that. And what we were also able to see is that this child didn't infect other people in his household. And so, again, we can't make huge conclusions about how contagious kids are just from one case, but I think it does give me some and give us some optimism about growing research that is showing that maybe kids without symptoms aren't the quote super spreaders or aren't super as contagious as maybe once thought.
Right. Okay. So every parent is thinking about school right now. So what are your big takeaways from this study as far as school concerns?
Yeah, I think school is really a reflection of the community where it is. And so I think the big takeaways are, especially at that time in Marion County, numbers were for us were relatively low in terms of asymptomatic kids that were, or people that were infected. And so I guess what we can take away is that schools, I think the goal is obviously to get back to in-person classes and in-person school. And so in an area where the transmission and the rates are low, I think that we can say that maybe the asymptomatic rate is fairly low as well, and we can feel better about continuing to do the safety precautions, but getting back into schools, which is obviously, I think, everybody's goal.
One thing you mentioned I thought was really interesting is throughout all this, the pendulum has sort of been swinging. It was first kids are super spreaders, and then it was swinging towards they're immune. And you think the answer really might lie somewhere there in between?
It usually does, and it's probably the case for this as well. I think that most likely kids are able to spread the virus. I think we know that, but probably not to the extent that maybe first thought where they were super spreaders. Respiratory viruses, kids do shed it and spread it quite a bit for whatever reason and for a variety of reasons. That probably isn't the case for COVID, but that doesn't mean that they're immune. So I think that being really cautious and kind of listening to health officials, keeping social distancing and masking is really important. But I do think that I'm optimistic that maybe they're not the source of outbreaks and infection, and that we can hopefully get them schools, either keep them in schools or get them into school if they're not already.
It was interesting. This child living in a house with 5 other family members, and none of the family members have tested positive since, as you have followed them up. So you are planning a follow-up study. Tell us about that and what you hope to learn from a follow-up study.
Right. So what we were able to do for this study was look at one point in time. We did those nasal swabs, and we were looking at who had the virus at that point in time. What we want to know in the follow-up study is who has been exposed or who has had infection in the past, and the way we measure that is through those antibodies that people have heard of. And so our follow-up study is looking at the same cohort of people, but now testing the antibodies to see if any of those people may have been infected or been exposed to the virus and showed immunity to that at this point. And so that will give us a bit broader picture of exactly or in a longer frame of who's had the infection without symptoms.
Okay, I know that you are sharing the study results with decision makers at the state level. Thank you so much for being on the show today and helping us make a little bit more sense of the science.
You're welcome. Have a good day.
You too. Gary, back to you.
All right, Kylie, thank you. Also making headlines this week from the IU School of Medicine, it was selected as a site for a COVID-19 vaccine trial. Now, the AstraZeneca-sponsored Phase 3 trial is part of the U.S. Department of Health and Human Services Operation Warp Speed. It's a partnership with Oxford University and is moving ahead with its late-stage clinical trial for a vaccine known as AZD 1222. The Phase 3 clinical trial is the last required stage of study before the potential vaccine can be approved by the Food and Drug Administration for widespread public use. It is one of only 4 vaccines in Phase 3 testing for the prevention of COVID-19 in the United States. Researchers plan to enroll a total of 30,000 participants at 81 different sites around the U.S. for this study. People from across the state are invited to participate, but volunteers will need to travel to Indianapolis to receive 2 doses of the vaccine or a placebo, as well as attend follow-up visits. Volunteers will be compensated for their time and participation.